everyone. I am Eliza Janina Iuson, and the first topic that I will discuss is about moral principles. Personally, when I hear the word moral principles, the first thing that comes into my mind is that these are guidelines that people live by to make sure that they are doing the right thing. However, in this module, these moral principles are incorporated into professional codes of ethics, organizational value statements, and position statements published by professional groups such as the American Nurses Association, which is also known as the ANA. This code forms the cornerstone of nursing practice, which means na ito yung nagsisilbing foundation ng nursing practice. And also, this code aims to provide nurses with tools for identifying ethical responsibilities and to guide decision-making within the primary goals, values, and obligations of the profession. Next is advocacy. So, advocacy, it refers to a loyalty and a championing of the needs and interests of others, requiring the nurse to educate patients and their families so that they know their rights, are fully informed, and can access all the benefits they are entitled to. Nurses also advocate for patients by supporting them in their efforts to retain as much autonomy as their abilities allow. To have a better understanding, nurses can act as mediators between patients and doctors who may have overlooked certain patient needs or solutions. For example, if a patient receives an inaccurate diagnosis, unsafe accommodation, or unclear instructions for self-care, the nurse must alert the doctor or medical facility and communicate the issue. Next is autonomy. Autonomy is the concept that each person has a right to make independent choices and decisions. So it is reflected in guidelines and laws regarding patient rights and self-determination. Evidence of respect for autonomy is found in care that consider the patient's lifestyle, the value system, and religious beliefs. So, yung respect dito, it doesn't mean na ini-ignore ng nurse yung mga paniniwala and yung choices ng patient. Rather, nire-respect niya yung patient as a person with autonomy and with rights. So, autonomy is also supported by informed consent and on patient and family education. For example, right to refuse treatment and the right to participate in research or refuse it. So, si patient may karapatan siyang tumanggi or pumayag sa mga decisions about his or her medical care, and to exercise this right would require informed consent. So, it requires physicians to respect patients' autonomy by giving them the information needed. So, dapat mag-provide ng necessary information yung healthcare provider for the patient, including their family, to understand the risk and benefits of a proposed intervention, as well as the reasonable alternatives, including no intervention at all, so that they may make independent decisions. And then another principle is beneficence or non-maleficence. So these concepts of do good or beneficence and do no harm, or also known as the non-maleficence, are integral to healthcare. So yung mga nurses ay intended na gawin kung ano ba yung makabubuti para sa patient nila. And a more detailed explanation would be, beneficence refers to taking actions that serve the best interest of patients. So it involves the obligation to help those who are in trouble and protecting patients' rights, providing treatment for those who need it, and preventing further complications. So, on the other hand, non-maleficence basically means do no harm. In the practice of medicine, examples of non-maleficence include stopping a medication that is shown to be harmful or refusing to provide a treatment na hindi pa napapatunayan na effective talaga.